Good afternoon and welcome to this OncoAlert presentation performed in collaboration with the European Society of Gynecologic Oncology. Today we will be talking about an update in ovarian cancer surgery. And we will focus this update on the controversial question of the timing of primary surgery. And we will go through the results of the TRUST trial presented this year at the ASCO meeting and of the SUROVA trial presented at the ESGO Congress. So what is the rationale for primary cytoreduction? Well, we know that complete cytoreduction is one of the most important prognostic factors associated with patient disease-free and overall survival. And guidelines recommend primary cytoreduction when the surgery can be complete with acceptable morbidity. But several phase 3 trials have shown a non-inferior survival outcome for interval debulking surgery after neoadjuvant chemotherapy and suggested that this could be a similar strategy with inferior morbidity. But the results of these trials were criticized because of the poor surgical quality. The surgery was not performed in expert in centers, and maintenance treatment was different from the one that we use nowadays. So as you can see here, in this figure, we represent only the neoadjuvant chemotherapy arm population in the intention to treat analysis. We can see in orange all the patients, 100% of patients in the neoadjuvant chemotherapy arm. In blue, those patients that finally underwent surgery, and you can see that more than 15% of patients never underwent surgery. And in purple, the complete cytoreduction rates, which were very low in these trials. For example, for the EORTC trial, there was only 19% of complete cytoreduction in both arms. Then we have the results from the PARP inhibitors trials reporting that the best survival is observed in patients with complete upfront cytoreduction compared to complete interval cytoreduction. As you can see in the left side, the results from the SOLO trial, or on the right side, the results from the subgroup analysis of the PAOLA trial. So this is why the TRUST trial was performed, and the results were presented this year at the ASCO meeting. The objective of the TRUST trial was to elucidate the optimal timing for surgical cytoreduction, and the hypothesis was that primary cytoreduction is superior to interval surgery after neoadjuvant chemotherapy for overall survival in patients with advanced epithelial cancer. Inclusion criteria included advanced epithelial ovarian cancer, patients that were medically fit, resectable, and this study, in contrast to previous trials, included that patients should only be treated in expert cancer centers with defined quality criteria according to the ESGO recommendations. Patients were randomized to surgery followed by 6 cycles of adjuvant chemotherapy and maintenance treatment, or to 3 cycles of neoadjuvant chemotherapy followed by surgery followed by 3 cycles of adjuvant treatment and maintenance treatment. As I said, the primary endpoint was overall survival, and secondary endpoints included PFS, complete cytoreduction rate, morbidity. Concerning the results of the trial, we can see that more than 20% of patients were stage 4 in both arms, and more than 90% had a high-grade serous tumor in both arms. Concerning the surgical outcomes, we can see that upper abdominal procedures were performed in 79% of patients with upfront cytoreduction compared to 67% in the IDS group. And bowel resection was also performed in 68% compared to 38% of patients in patients undergoing IDS. Finally, complete cytoreduction was reported in 70% compared to 85%. In the intention to treat analysis, PFS was 22.1 months in the primary in the upfront surgery group and 19.7 in the interval cytoreduction group, and overall survival 54.3 compared to 48.3 months, and there was no statistical difference. Subgroup analysis shows improved survival benefit for primary cytoreduction in patients with complete surgery and in those with stage 3 disease. And as we can see, patients with complete cytoreduction had 6 months PFS and 12 months overall survival advantage when undergoing primary cytoreduction. Complications were described in 18% in the primary cytoreduction compared to 12% in the interval cytoreduction group. Let's move on to the SUROVA trial, which is a real-world study presented in ESGO 2025. This study included more than 3,000 patients from 55 countries, and authors did not report any significant PFS or OS difference according to the surgical timing. But when we look at the non-Asian population, the authors reported that the best survival outcome comes from patients who have complete surgery but with no postoperative complications, and this is very important. So what has changed in 2025? Following the TRUST and the SUROVA trial results, we can conclude that primary cytoreduction should be performed in patients with stage 3, in expert institutions with high surgical quality criteria, when cytoreduction can be complete with with a low morbidity rate. So what's coming this year? Very important, the updated ESGO guidelines for ovarian cancer that will be presented in Copenhagen in the ESGO Congress in February. And this year we will also have the results from the Chrono trial on the optimal surgical timing in patients that are undergoing neoadjuvant chemotherapy. So the 3 compared to surgery performed after 6 cycles. So thank you very much for your attention, and I hope to see you all in the upcoming ESGO Congress.